Good morning everyone. Today I am going to explain about pulpectomy. Pulpectomy is very simple procedure. It is just like RCT which is done in the permanent dentition. Now coming to the objective of pulp therapy or pulpectomy in primary dentition. As we all know that after a certain period of time the deciduous or the primary tooth sheds, and in place of that the permanent tooth erupts. So our main objective is to retain primary tooth. The next is to preserve the space for the permanent tooth, succedaneous upcoming permanent tooth. The next is to preserve premature loss of primary tooth. If there is premature loss of primary tooth, then there will not be an adequate space for the eruption of permanent tooth. So to prevent premature loss of primary tooth is the major objective of pulp therapy. To prevent loss of arch length, which enables proper phonation, mastication, swallowing. Now coming to the comparison of root canals in primary and permanent tooth. Root of primary tooth are longer and more slender. As we can see here that the root of primary tooth are slender and longer than the permanent tooth. Primary root canals are more ribbon-like or they are more tapered at the apex and have multiple fine filaments as compared to the permanent tooth. Roots of primary molar flare outward from cervical part of tooth to greater degree. Root of primary anterior teeth are narrower mesodistally than permanent anterior root. Primary tooth undergo physiological resorption. As we all know that um, over certain period of time, the primary tooth sheds, which leads to the eruption of permanent tooth. So at a certain period of time, there is resorption of primary roots, which is not same in the case of permanent tooth. Now coming to the definitions. According to Matthewson, pulpectomy is complete removal of necrotic pulp from root canals and coronal portion of primary tooth in order to maintain tooth in dental arch. According to Finn, pulpectomy is removal of all pulpal tissue from coronal and radicular portion of tooth. So coming to the main concept of pulpectomy. Pulp, at first, we have to remove all the carious portion uh, of the tooth. Then after that, we have to remove the coronal portion of the pulp. After removal of the coronal portion of the pulp, we have to remove the radicular portion of the pulp. So there must be a complete removal of coronal and radicular portion of pulp. Now coming to the objective of pulpectomy or pulp therapy. The first is infectious process should resolve. The infection which is present in the occlusal surface of tooth or interproximally, it should be removed. Now, the next is radiographic evidence of successful filling. As we know that after the removal of the radicular pulp, we fill it with a material which is called an obturating material. So, after filling the canal with obturating material, when we do a radiograph, it appears as radio opaque. So, the obturating material should be filled successfully into the canal. It should take the curvature of canal and should flow in the canal perfectly. Resorption of primary root at appropriate time. As we all know that the primary tooth undergo physiologic resorption. So the obturating material which we are filling in the root should also dissolve after a certain period of time. No post-treatment pain, sensitivity or swelling. In the majority of the patient, the main complaint is of pain, sensitivity or swelling. It should subside after the pulpectomy or pulp therapy. No internal or external resorption should be seen in the radiograph after pulp therapy. No radiographic evidence of further breakdown of supporting tissue should be seen. Now coming to the indications of pulpectomy. If any tooth has undergone previously a pulpotomy, which is basically the removal of coronal portion of the pulp, and now the tooth is showing an uncontrolled hemorrhage. So what we'll do is we'll remove the radicular portion of the pulp also. So this tooth is indicated for pulpectomy. In the absence of permanent successor tooth, if any primary tooth is not having the bud for successor tooth, then the preservation or retention of that primary tooth over that place is important. So it is indicated for pulpectomy. In case of several pulpal necrosis, if the infection has reached to the pulp, which has further lead to the necrosis of the pulp, then the removal of such coronal radicular pulp is important. So pulpectomy is indicated in this case also. Traumatized primary incisor with pulp exposure or acute or chronic abscess. In this case also will go for pulpectomy. Pulpless primary molar holding orthodontic appliance. Pulpless primary tooth in hemophilics. These all are the cases or indications of pulpectomy. Coming to the contraindication of pulpectomy. In case of excessive tooth mobility, will not go for pulpectomy. Insufficient tooth structure. If adequate tooth structure is not present, then will not go for pulpectomy. If there is any communication between roof of pulp chamber and region of furcation, or communication between oral cavity and area of furcation, these are the cases in which pulpectomy is contraindicated. Now coming to the steps of pulpectomy or pulp therapy. At first, the tooth is anesthetized with the help of local anesthetic. Depending upon the position of tooth, there are different techniques for the insertion of local anesthetic. After the application of LA, the tooth is isolated. The isolation of tooth is done by rubber dam or cotton rolls. After that, by the help of aerator and burr, we remove all the carious portion of the tooth, whether it is present on the coronal or interproximal surface. After removal of the carious portion of the tooth, the coronal portion of the pulp is also removed. Then we get access into the radicular pulp. The radicular pulp is removed with the help of different color coded files, and then we have to do the enlargement of canal. Enlargement of canal is also done by different color coded files. So during preparation of canal or biomechanical preparation, we generally do is step back technique. During during this technique, we have to irrigate the canal continuously, which is done by sodium hypochlorite solution. After that, we place the medicament into the canal. The drying of the canal is done by paper point, which also comes in different numbers. After the drying of canal, we just fill the canal with a material which is called obturating material, and the process is called obturation. Coming to the follow-up and review, after the pulp therapy or pulpectomy, when we call the patient a week later, we see the tooth clinically and radiographically. Clinically, we see that there is the improvement of acute symptoms, the symptoms which the patient has come initially, that is pain, swelling, has just subsided or not. Radiographically, we check that there is improvement or no further deterioration of bone condition in the furcation area. Now coming to the criteria for ideal pulpectomy obturant. It should be antiseptic, resorbable, harmless to adjacent tooth germ. It should be radio opaque. It should be clearly visible in the radiograph. Should have easy insertion and easy removal. Should not shrink when placed into the canal. Should not discolor the tooth. Different obturating material. Uh, These are zinc oxide eugenol, KRI paste, Workhoff's paste, Masto paste, calcium hydroxide, Metapex, Vitapex. It can be placed into the canal and is used as obturating material.